Good morning. It is Monday, the 11th of January 2021, and welcome back to a new edition of the local news. In the news for today, waste collection will be addressed differently. Government is already informed about national vaccination plan. Subsidy for medical supply for hospitals ended, and Social Economic Council gave advice to the Minister of Finance. In the context of a friendly environment, a variety of activities will take place. Minister of Public Works Riyad Nur Mohammed informed this to the press last week. For example, he indicated that the garbage collection service will be addressed differently. The minister sees a public-private partnership with entrepreneurs as a good option. Conrad Issa, the CEO of Doyo and Lucky Store, is hugely pleased with this announcement. But he thinks that the companies that operate in the center of Paramaribo should be given the opportunity to close private contracts on their own initiative with the garbage collection services. According to the minister, the environmental police will be further equipped to perform its task better. He explained that changes to legislation and regulations have already been considered. According to Nur Mohammed, the environmental police, with the law in their hands, can take action against pollutants. First, people will get a warning. If they do not comply, there will be a fine, followed by other punitive measures. The government has already been informed about the national COVID-19 vaccination plan, so says Minister Amar Ramadan of Health. There is close cooperation with the Pan American Health Organization. As soon as everything is in order, the vaccination plan will be communicated with the society. The Netherlands has already started to vaccinate its medical personnel in different hospitals, and one of them is Melvin Boerleider, who works as an ICU nurse in the Diakonessenhuis in Utrecht. He was vaccinated against the coronavirus on Thursday, January the 7th. The government subsidy for the supplies of medicines from the Bureau of Medicine Supply, BGVS, for all hospitals will be discontinued. This has been determined by the Ministry of Health in consultation with the Ministry of Finance and Planning. According to Health Minister Amar Ramadan, this subsidy scheme that was put in effect by the previous government did not work. There are arrears payment of no less than 40 million SRD at the BGVS. With the new measure, hospitals have to claim the cost for the provision of medication to the various health insurance companies. Minister Amar Ramadan says there should be no concerns that the hospitals will be left alone. Dayan Sankar Mathura, director of the Slans Hospital, says that talks with the health insurers about adjusting the hospitalization rates now are very necessary. Rates would not have been adjusted since 2014, and the previous government had decided to use a subsidy for medicines to accommodate the hospitals. Further discussions on this subject will follow today in the National Assembly. And the note from the Ministry of Finance on macroeconomic policy recovery has been provided with advice by the Social Economic Council, SER. This happened during a meeting with President Chandrika Prasad Santokhi at his cabinet. It regards, among other things, the monetary and fiscal measures, the introduction of further cuts in the government spending, and the effects of any salary pay round by the government. According to the SER chairman Sila Kisung Singh, it is extremely important that the government will include the findings of the social partners in the proposed measures to get Suriname out of the economic crisis. President Chandrika Prasad Santokhi previously announced that the insights of the social partners are important in policy making. It ensures that decisions that are made have a positive effect on the socio-economic situation in our country. In its advice, the SER argues for a solid social safety net as part of the measures it is to get the economy back on track. That is it for the local news for today. Head back tomorrow with a new edition. Until then, bye-bye.